All right, so our next speaker will be Erica Siegal. There she is. Awesome. All right, come on up. She has also been an integral part of putting this together. And before you start, you stay up here with me. I was thrilled to, it kind of just came out this way, but I'm really glad that this happened. But all of our speakers are women for this event. And I think it's just empowering women to use their voices and me, again, so that this idea of balancing the conversation, I think is really important. So I'm just thrilled that we've all come together and collaborated on this. So thank you.
Hi everybody, can you hear me? Ooh, microphones, it's weird. I think it's good. Okay. Hi everybody, so great to see all your beautiful faces. My name is Erica Siegal, and I'm going to kind of discuss psychedelic harm reduction and some interventions that therapists and other kind people in our community are using at festivals and in non-traditional clinical settings to treat people who are having challenging psychedelic experiences. So I am, I've been affiliated with MAPS, which is the Multidisciplinary Association of Psychedelic Studies, since 2012. I've been working for the Zendo project, which is a nonprofit that provides harm reduction at transformational festivals since 2013, and I'll be running the space this year at Lightning in a Bottle and at Burning Man. I also, I'm a clinical social worker. I have a master's in clinical social work from USC, and I'm also the research assistant on an MDMA-assisted psychotherapy study that's taking place at Harbor UCLA to treat social anxiety in autistic adults. So if you have any questions about clinical research, please feel free to find me afterwards, but I'm not going to talk about it today. Wrong direction. All right, so just to give you a little overview about what I'm going to be talking about, kind of the emerging psychedelic renaissance. All of you are here because we're part of this psychedelic community that's really re-emerging in our culture in the past 15 years. I'm also going to talk briefly about interventions for challenging experiences and self-care techniques for those who are providing these services, which is just as important as providing those services, making sure that you're taking care of yourself. So if you haven't noticed, in the past 15 years, there's been an increase in psychedelic use in the medical community and in the spiritual community, and also in the recreational community. Currently, in the United States, there is active psychedelic research going on with MDMA, psilocybin, and cannabis. And in Europe, there is also medical research going on with LSD right now. You might have seen, it's kind of been all over social media. The spiritual use, the use of things like ibogaine and ayahuasca has kind of re-emerged in our Western culture, although it's been used for thousands of years in South America and Africa. And so those have kind of also re-emerged and are now kind of becoming more popular within the Western population. With that, recreational use has also increased. And that increase is kind of a result of the increase in annual experience-based events. Things like Burning Man, or Coachella, which none of us are at right now. Or large-scale music festivals, Bonnaroo, Electric Daisy Carnival, things like that. And so one of the things that is really interesting is over the past 25 years, there has been a 70% increase in experimental spending amongst our younger generation, kind of 20s, 30s, maybe millennials, Generation Y. 82% of people in the United States between the ages of 20 and 30 have reported attending experience-based events. So 82% of people are going to at least one of these large-scale events a year. In addition to that, 77% have agreed that their best memories were made during these events, and 72% agreed that they are planning on increasing their attendance, which is great for events like this that are nice and small. People are really wanting to engage in human connection and engage in transformation in environments that are designed for consciousness expansion and experience. And it's really important because the use of psychedelics and use of drugs and also alcohol included in that is also increasing. And there's a crisis going on in the medical community about, in the first aid festival community about how we can best serve these populations of people who are having challenging experiences. So what is harm reduction? Harm reduction is a set of practical strategies and ideas aimed at reducing the negative consequences associated with drug use. Harm reduction is also the movement for social justice built on the belief in and the respect for the rights of people who use drugs. So what we're trying to do at these events is, if they are having a challenging experience, if they've taken too much, what we're trying to do is help them stay in a container where they're not going to face massive hospital bills, where they're not going to face threats of incarceration, where they're not going to face possible deaths and overdoses and harming themselves and harming others. And so harm reduction in the festival world is really about creating a safe container for people to go through these challenging experiences. Also, harm reduction, there's a Dance Safe booth back there. They're maybe going to say something in a little bit. They provide free drug testing at events to make sure that people are know what they are taking. So, yay! So there are organizations like Zendo, there are organizations that, like Dance Safe, like Full Circle Tea House, if you've seen them, different Full Circle than Venice, but also, and Cosmicare at Boom in Portugal is an event that happens every other year. The most interesting thing about Boom is Portugal decided that they were going to decriminalize all drugs. Wow. And instead of treating it as a criminal issue, they treat it as a public health issue. So Cosmicare's harm reduction at Boom has a staff of over 200 individuals, doctors, people who are providing drug testing, people who are providing public service, kind of like the Woodstock, like don't eat the brown acid stuff. They have, at Boom, they have a screen, much larger than this one, flashing by pictures of drugs that people have submitted for testing, reporting exactly what it is. So there's a picture that would say, like a little picture of maybe a piece of blotter that says, this is not LSD, this is DOC. Don't take this unless you're planning on hallucinating for the next 18 hours. Things like that are probably useful information to know. So Cosmicare has this great model for really providing like a multidisciplinary work around harm reduction. And so it's really beautiful. I would love it if we could get there in the United States, and hopefully we will one day. We will. So Zendo started in 2012. We've had a presence at 12 different international events, including Envision Festival in Costa Rica, Africa Burn in South Africa, Burning Man, Lightning in a Bottle, and we're growing every year, and we're getting requests to have a presence at more and more events every year. So we're constantly looking for volunteers to come work with us. We've assisted over 600 guests, and we've avoided hospitalization and incarceration for dozens of people that have come through. So I'm going to talk a little bit about Zendo principles of care. If I can find the card that talks about it, there it is. So we work on 4 pillars, and the 4 pillars are creating a safe space, sitting, not guiding, which is really important, talking through and not down, and difficult is not the same as bad. So working with these experiences, the sitter and the guest can oftentimes make a difficult or challenging experience a chance for personal growth. And that's really what our volunteer staff does. Also, there's a code of conduct. People that come in are in oftentimes severely altered states. Sometimes they can be overtly sexual when they are in these altered states. Unbelievably important to have professional decorum. We try our best to gender match a female sitter with a female guest, male sitter with a male guest. Doesn't happen all the time, but we really are conscious and aware of providing a safe, caring space for people to go through these experiences. Before we allow people into the Zendo and into our space, and this is kind of what differentiates us from Countercare, we need to make sure that everybody that comes in does not need medical intervention. We are not providing medical care. We are not doctors. Therefore, we don't provide medical care. We want to make sure that they have safe blood pressure, safe heart rate, safe body temperature. If somebody's experiencing exposure or hypothermia, we want to make sure that the medical staff is there to take care of them. We also need to make sure that they don't need psychiatric intervention. This has happened at every festival that I have worked at, is we have had at least one guest come in with a non-drug related mental health crisis. Whether it's, I've been at this event, I lost my meds, I've gone off my meds, I'm unstable. We've had people who have been actively suicidal that we've had to hospitalize. And there's usually, with the Zendo, the people who run the Zendo, we are all trained psychologists and clinicians. We're able to do those evaluations and kind of assess whether or not this is the right place for them. If it's not, we do send them to the place that would be best served for them. Also, that they are not a recent victim of domestic violence or sexual assault. If somebody comes in and we suspect that they have been assaulted while they were under the influence, we absolutely involve the authorities. We don't try to protect we don't try to hold people back from utilizing proper legal channels to get themselves protected. And so we do collaborate a lot with the law enforcement that's there and the medical staff that's there to make sure that we're providing the best care. Also, we are not doctors, and medication can only be administered by medical doctors. And so we don't use any medical interventions. We have in the past brought a doctor in to do an evaluation, and they have used things like Thorazine, hydroxyzine, alprazolam, things like that. We do not give those out. We believe at the Zendo that we help them work through their challenging experience using non-medical interventions. And sometimes some people don't agree with that, and that's okay. We really try our best to help them work through. There's been a lot of reports of people who have had medical interventions while having challenging psychedelic experiences, and they come out of that feeling really unresolved, feeling like they haven't completed a process, that something kind of cut them off. And so we really try hard to not provide medical intervention unless it's absolutely necessary. So what is a psychedelic crisis? A psychedelic crisis can be trauma, whether reliving past trauma, experiencing lineage trauma, which is a trauma that's been passed down through your ancestral line, experiencing the feelings of reliving the death of a loved one, or some sort of assault or violent act against them, or even a car accident. A lot of times people come in and they're feeling like they're getting re-traumatized while they're under the influence. Having a near-death experience, feeling like you're leaving your body, or having an ego death, feeling like you've died and you're now in another space. Experiencing mystical states, feeling like you have superpowers, feeling like you can control people's minds. Being caught in a time loop, which is one of my actual favorite psychedelic crises to sit with. Which is a weird thing. I mean, a lot of people feel, because you lose your sense of time when under the influence of psychedelics. And sometimes, even though it might be 15 minutes, it feels like you've been in this loop for like an hour or a day or a month or a lifetime. And so it's often really nice to kind of reassure somebody, like you took a drug and it's working, and like it'll wear off at some point. But a lot of times you get overwhelming feelings, overwhelming emotions, panic attacks, elevated anxiety levels, things like that. But all of these can be disorienting, confusing, and anxiety-provoking. And so even though it's drug-induced, it feels so real to the people that are coming in. And it's really important to kind of acknowledge the fact that this is an experience that they're having. So psychedelic sitting and peer support. We cannot, as a clinician, I cannot provide traditional psychotherapy to anybody that comes into a harm reduction space. A couple of reasons. I can't ensure confidentiality. They can't take proper medical history. They can't consent to treatment because they're in an altered state and you can't give consent. And so what we really like to call it is kind of psychedelic sitting or peer support. A lot of times, it's just basic hospitality. How many people in here have been to Burning Man? Ooh, nice. How many people have had some sort of non-drug induced, but some sort of emotional breakdown because you're too hot, you're too dehydrated, you're too, you have to bike 3 miles back to your camp in the middle of the night, and it's just awful. And so a lot of times it's that basic hospitality. Come in, sit down, let me fill up your water bottle for you. Let me give you a granola bar. Let me give you a quiet space that's not filled with blinking lights, that you can actually kind of like collect yourself. We get a lot of that coming in too. So meeting your basic needs, food, water, shelter, safety. It's true. I cry every year on the playa. At least once, because I'm uncomfortable. Compassionate listening. So some aspects of compassionate listening can be echoing or reflecting what people are saying. You can say, I know, like, I hear you that you're feeling overwhelmed. I hear that that you're missing your mom. I hear, just being able to kind of acknowledge what they're saying and having a presence of somebody sitting there, acknowledging their experience, really important. Be honest. Like if somebody's talking gibberish, you can say, I don't understand what you're saying. Like it's okay. Respond in a way that shows that you're trying to understand. You can say, can you explain it to me in another way? Kind of explore maybe what they think would be a positive outcome from this experience. Like what do you need from us? How can I be of service to you? Such an important aspect of providing peer support. Also having a sense of humor is really useful. A lot of people come in feeling really embarrassed or really ashamed or really, and that's also something that you really want to acknowledge. Like, I hear you, I hear that you're ashamed. I hear that you feel like you embarrassed yourself by like screaming your girlfriend's name on the dance floor at the top of your lungs for 15 minutes while security like danced around you. Like, it's embarrassing. And it's cool. Like, oddly enough, you're not the only one who's doing that. So, it's good. Expression through sound or art or music. A good primal scream can do a whole bunch. And giving somebody permission to go there can allow them to process whatever they're holding on to. Doing breathing exercises. If somebody is anxious, putting your hand on their hand and saying, let's take 5 deep breaths together, can totally shift where their head is at. And so it's really important to kind of utilize like your own skill set, being able to provide this type of care. Also, not minimizing the experience, acknowledging like, yes, this is hard, yes, this is challenging, but I'm here for you. Like, I'll be able to sit here with you all night if you need me to. And having somebody to go through these experiences with, so beneficial. So another thing that you can do, maybe suggest that they may want to wait until their experience has resolved to assess decisions in a clearer light. You kind of get the person who's like, that's it, like I'm quitting my job, I'm like selling all my earthly possessions, and I'm like gonna live in the jungle, and it's like, that's cool, like maybe wait 6 hours, and then like call your family and tell them that that's what you're gonna do. And then reassure them that they're in a safe space and that they're being cared for. A lot of times when you get these people who feel like they're dying, a simple, reassurance of being like, I'm here, I'm going to keep you safe. Like, that's what I'm here for. I have a good friend who I do a lot of harm reduction with, who does this little thing where she'll look at them and she'll be like, if you were really dying, don't you think that I would probably be like a little bit more like anxious about this whole situation? Like, if I'm just sitting here calmly, like, trust me, you're not dying, like, it's cool. And so, kind of being able to acknowledge what they're feeling, but also being able to kind of be like a calming presence among them is also really important. With that being said, not everybody that comes into a harm reduction space is the right person for you to work with. There's a thing called countertransference where you too can get triggered. If somebody is coming in and they feel like they are reliving a sexual assault and you also have had a similar experience, you are not required to sit with them. If you lost a loved one in your life and somebody comes in and they totally remind you of that person and you're like, I just can't be with this, there's a reason that we require, when we have a Zendo presence at an event, that we require people have 5 or 6 people on shift. So if you're like, this is not the right person for me, you have permission to kind of say, you want to know something? Let me introduce you to my friend Ashley, or let me, and it's okay to kind of, we call it pass it sideways. It's okay to kind of pass it sideways. Also, if you don't have your basic needs met, like food and water and rest and sobriety and things like that, it's okay for you to be like, you want to know something? I need 10 minutes to collect myself, or I need to pee, and I can't sit with this person for the next 4 hours because all I'm going to think about is how much I have to pee. Like, it's okay to take care of yourself. In addition to that, a lot of times people who have worked in harm reduction have seen people go through these really challenging experiences, and it's hard for them as a caregiver to kind of process what they've experienced. And so the Zendo Project and Cosmicare and some other organizations have set up kind of closed social networking groups that you can say, you want to know something, I had a really tough experience sitting with this person at Lightning in a Bottle, and I keep like reliving it over in my head of being like, could I have done something better? Could I have, helped this person more? We offer community support for anybody who is sitting or anybody who's volunteering in these spaces. And if you need a referral to somebody in your own community, we provide that also. And so it's really important for you to take care of yourself. Because if you're not taking care of yourself, you can't take care of the rest of the community. And so with that, I think if anybody has any questions about harm reduction, I feel like maybe I have a few minutes to field them. Maybe not? Okay. Then no questions, come find me afterwards. Thank you. I will be at the maps table. it's a $30 charitable donation to Max. And so thank you, everybody. Thank you, Ashley.
Woo!